Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Hello and welcome to Fronteras, at Changing America. I'm Anthony Maternal. It's no secret that New Mexico is ranked as one of the worst states for child well-being. In 2019, the New Mexico legislature and Governor Lujan Grisham approved and established the Early Childhood Education and Care Department to address these challenges. In July of 2020, the department officially launched. Joining us on the program to talk about initiatives that the department is implementing is Cabinet Secretary of the New Mexico Early Childhood Education and Care Department, Elizabeth Groginsky. Thank you so much for joining us.
Thank you, Anthony. It's so wonderful to be here.
Let's start off by learning a little bit more about this new department. Can you share with our audience what exactly is the mission of the department and what areas does the department cover?
Thank you. Our mission is actually to optimize the health, development, education, and well-being of babies, toddlers, and preschoolers through a family-driven, community-based early childhood programs and services. But the mission, the department came together from a combination of programs and services from the Children, Youth, and Families Department, the Public Education Department, and the Department of Health. So a central focus of our work is on that prenatal to 5 period of life, the most critical and rapid period in any human's life.
Secretary Groginsky, it'd be great to learn a little bit about your background. Can you share with the audience a little bit about your history in this field and what exactly brought you here?
Yeah, thank you. Yes, my history started in early childhood in 1997 at the University of Colorado, Denver, where I was able to work as an evaluator and a researcher on a community-wide collaboration to improve the quality of childcare. It came on the heels of a national study that showed that childcare in most places in the country was low, poor to mediocre. So a group of people came together to galvanize their resources, and I had the opportunity to evaluate and work on that project, which inspired me to learn more about early childhood. I was able to lead a Head Start program in a large county just north of Denver, and from there go on to lead the Head Start Collaboration Office for the state of Colorado. Traveling the state, learning, just like I've been doing over the last 3 months here in New Mexico, how communities implement early childhood programs. That took me off to Washington, D.C., where I got to work at United Way Worldwide, looking at communities all over the country and helping them build stronger systems for families and children.
So with this field, there's so many challenges. We've done a lot of reporting and discussed on this program how New Mexico is ranked compared to other states when it comes to child well-being. It hasn't been good due to the research that we've got from the Annie and Casey Foundation, the Kids Count data book. Unfortunately, New Mexico has ranked low in many areas with this. What are some of the issues that you think are really leading to New Mexico being so low in these rankings when it comes to our youngest and most vulnerable?
I think it's some of the things that Governor Lujan Grisham has put her, from day one said, we need more access to high quality pre-kindergarten, pre-K programs, and they need to be full day. We also need more access for families to home visiting, evidence-based home visiting that can help them learn more about what it means to be a parent, what are the skills, what are the everyday activities that we do with our children that build strong brains and build strong development. So those are just 2 of the programs that she has emphasized we must expand. But we have to do more than just expand the services. They have to be high quality, and the people working in those programs have to be paid and compensated at the level for the value of the work that they're providing to families and children. So those are some of the top priorities that the governor has charged me to do and that we have implemented successfully, but we have more to do.
So when you say you have more to do, I mean, what are the major challenges? You brought up a couple of things like improving home visits as one, and then having high quality care and qualified people to go into homes to perform these visits. Some folks who are watching this might not even understand what goes into a home visit like this. So maybe you could share that with us about what are the goals with these home visits.
Well, we had a great opportunity this morning to meet with the Community Action Agency of Southern New Mexico and talk with a home visitor who was a mom in the program, a young parent. And what they're doing is they're connecting with families where they are. So if there's a family who's struggling to figure out whether I should continue to go to school, work, how do I talk to my pediatrician about my concerns, this home visitor is there to support that mom, that father, the family as a whole, to better their interactions with their children, to advocate for themselves. That's what this mom told us today, to speak up, but also to connect them with all the resources that are in the community that they may in fact need but not be aware of.
So what does the research show us that these home visits, what does the research show us how they can make a difference and improve the quality of life for kids and the education of parents?
We have seen incredible results in terms of the positive parent interactions. So families learn different ways to interact with their child and the importance of those interactions in their child's development. We also do maternal depression screenings, sometimes because we work with families prenatal all the way up to age 5. So connecting mothers with behavioral health when we do identify maternal depression, all of those things we know contribute to a more positive and a supportive family environment. So home visitors are doing everything from getting families the resources they need to talking with the parent, but the parent is delivering the curriculum. So that home visitor is going in weekly, maybe twice a month, and helping the family understand how to educate and support their child with the skills and the knowledge that that family already has.
It seems like we're having a larger conversation on mental health for various reasons and events that have happened across our country. How big of an issue is maternal depression in New Mexico?
You know, we think it's pretty significant, and we think it's also something that often goes unrecognized, which is why home visiting programs become such a critical piece of supporting families and helping that healthy development of children. Because if a mother is depressed, their ability to effectively engage and support their child's needs is limited and it's hampered. So we know that working through the Behavioral Health Collaborative and our other cabinet level agencies, we are building a much stronger behavioral health system here in New Mexico. So that's another key part of the Governor Lujan Grisham's cabinet is we work so collaboratively. I could not do the work that I do without my fellow cabinet secretaries at my side.
Now, if a child does grow up in a home where there is maternal depression, how does that affect the child? What are some things that research shows us how that could affect a child as it ages?
Well, we talk a lot about the early years and the million neural connections that are made in a baby's brain every second. So when a child looks at you and you look back at them and you smile at them, the connections in their brain are building that architecture of a brain that will serve them not just educationally, but it's also their health and their overall development and well-being is being formed in those early years. So a mother who's depressed when the baby coos or laughs at them, they may not have that feeling to do that back. It's called serve and return. So anytime a baby engages us, we want to, they serve us something and we want to return something. And that's what brings the brain development and the wiring of the brain that leads to what the neuroscientists and everybody has said. Your long-term health outcomes, your educational outcomes, and the overall well-being of a human being is set very strongly in those first 2 years of life.
So how is New Mexico doing right now in ensuring that there are enough qualified people in place to make these home visits?
We are doing, the governor has charged us with really building the early childhood workforce. So today, again, at the Community Action Agency of Southern New Mexico, they have grown from 3 home visitors to 14 home visitors. They have associate's degrees, but they're also, even if they don't have the educational degrees, they are getting incredible evidence-based training and professional development that's helping them more effectively engage families. But we want all our early childhood professionals to seek certification, to seek associate's degree and bachelor's degrees, and we support that.
So tell us about the initiatives that the state is doing right now to ensure that folks are pursuing the education that they need so they can continue to advance in this field.
So, I mean, we all know that the governor it has Opportunity Scholarship, so that's fantastic that every New Mexican can pursue higher education. The department specifically has done a few things. One, we have scholarships for all early childhood professionals, CDC, Child Development Certificate, an associate's degree and a bachelor's degree, and we have seen our home visitors take a lot of advantage of that, as well as our early intervention providers who serve children, infants and toddlers with developmental delays and disabilities. So through that, we also recognize our professionals who speak more than one language and are bilingual, and we give them a $1,500 one-time incentive. And we also recently, the governor helped us announce a student success. So if you're pursuing an associate's degree or a bachelor's degree, you've got your books and your tuition covered now through Opportunity Scholarship. We are going to pay you an additional $2,000 a semester if you're taking 6 credit hours for your utilities, your rent, your transportation, your gas costs. We want early childhood people to know they're valued and they're respected, and this is the way that this department, through our leadership of our governor, is implementing strong early childhood workforce development.
Now, one of the big challenges in the field is just being able to pay people a salary to live on.
Yeah.
How is New Mexico doing in that? I know there's been efforts to address this issue. How is New Mexico doing in ensuring that there's a sustainable growth in funding for this field, and so people who may be interested can find and make a living out of it and pay their own bills?
That's right. It's such a great question because I get asked that a lot as I travel the state. So a few things that we have done to improve the compensation for childcare, for instance, for infant, toddler, preschool, school-age childcare providers, is we implemented the first in the country reimbursement rate based on what it actually costs to provide the care. So we are hopeful that our child care programs, we visited Cradles and Crayons earlier this morning, they will be paying their staff what it actually costs for them to deliver that care. So they're paying higher wages. We're also working with our home visiting programs and early intervention to do a cost study as well. What should we be paying our home visitors? And then using the second thing that the governor did after her first year was create the Early Childhood Trust Fund. With the support of the legislature, that trust fund is growing and working in the way that the governor and the legislature designed it, and that is going to produce funding to the department. Compensation has to be one of the top priorities that we focus on, because the work that these individuals are doing, it's building our future. It's supporting our families. It's going to turn around those numbers that you talked about early. The 49th, the 50th, 47th, that's not where New Mexico is going to be in 3, 4, 5 years under Governor Lujan Grisham.
Now, there's been so many challenges with this issue, early childhood education and care in New Mexico. A lot of the research that we know so far is research that was taken before the pandemic. So maybe we could learn a little bit more about really how the pandemic has impacted early childhood education and care. Are we getting the data now? Do we have an understanding?
Yes, I think one thing that was highlighted through the pandemic is how essential childcare and home visiting programs and early intervention were to families, especially childcare. We saw this in the early stages of the pandemic. Hospitals, doctors, nurses, they couldn't get to work because childcare programs weren't open. So it highlighted an important industry in every community, and the governor immediately picked up on that, and that's why, most recently we have just launched the most expansive childcare assistance, eligibility and assistance expansion in New Mexico history and in the United States history, because what we saw is that childcare providers were struggling to get the money they needed to get the enrollment, and families were struggling to pay for the high cost of childcare. So just in May, the governor expanded to 400% eligibility childcare for New Mexicans. That's $111,000 for a family of 4. So we think most New Mexicans will benefit from having their childcare entirely paid for. No co-payments, free childcare. As I've spoken to providers, it has been a lifesaver, because they know they can guaranteed revenue income to keep themselves open, and they can expand. And families, we get the most heartfelt calls from families every day. I didn't know how I was going to make it. A father that we spoke to was going to have to take his child out of childcare because he didn't know how he could afford his copayment. So those are the kind of things that we're doing to both help the childcare industry rebound and help families relieve their financial burden so they can get back to work. I just talked to a woman yesterday here in Sunland Park who said a mom said, I can now go back to work because of what the governor did in providing free childcare.
Well, there's been so much concern around this issue, obviously from parents, of course, but also folks who are running facilities about just if they could stay afloat. Do we know how many child care facilities, early child care facilities we lost during the pandemic?
You know, the good thing in New Mexico is that we stood there with child care programs from the beginning. So we gave them incentives. We helped them even before the federal relief money came. And then when we received the American Rescue Plan, we issued $158 million to 1,000 child care providers across our state almost immediately. We were one of the first states. You know, we issued that money. I am proud to say that New Mexico has as many centers now and facilities as we did pre-pandemic. We have more children accessing childcare through the child care assistance because we expanded eligibility and because we are paying rates that actually reflect what it costs to deliver that care. So this has been a game changer, I think, and I'm hoping that child care programs across New Mexico would say the same thing to you and the families who are accessing that care.
What are your concerns right now? It's the whole country's dealing with rising prices,
Exactly.
rising gas prices. Some families may be concerned if they could even make the trip to take their child to daycare. What are your concerns with this issue, and what is the state prepared to do to address it?
Well, I think we were concerned about that, and that's why the governor said we have to waive parent co-payments. We have to expand eligibility because parents are paying more for everything. So we're hopeful that by not having to pay $1,000 or $1,500 a month out of pocket for their child care, they're now able to cover some of those expenses and hopefully even invest in the future. The thing that we're grappling with in early childhood, as we are across all industries, is the workforce. So I think what we're doing, both with Opportunity Scholarship, the student supplemental support, paying students to go to college, and also mentoring and coaching, because it's not easy to go back to college. And if you never thought you would go to college, there's a lot of support that's needed. So working closely with Secretary Rodriguez and myself and the higher education institutions like New Mexico State University and Doña Ana Community College, we are thinking strategically. How do we recruit the workforce? How do we get people excited about a career in early childhood? And then how do we wrap around them and make sure they have what they need to complete that degree, to complete that certificate?
Well, that's obviously been a challenge in education about preparing the next generation of educators or caregivers in New Mexico. So there is a lot of support from what you say you've denounced, but how sustainable is it? I mean, we live in a state that heavily depends on how well the oil and gas industry is doing. Just several years ago, when the industry wasn't doing well, New Mexico had to take money from school districts to pay the bills. So what are some of these things that you're focusing on that you think can be sustainable no matter how good the economy is or how bad the economy is?
Well, I think when we invest in our children and we invest in our families in these early years, the return is so strong. It could be $7, it could be up to $13 returned to our state in reduced special education, reduced children repeating grades, reduced juvenile delinquency, all of these things, improved health outcomes. So by investing early, and because the Early Childhood Trust Fund is growing, expected to reach $2 billion next year, producing and distributing to the department 5% of that annually. And this November, the voters of New Mexico are going to be able to say, do we believe that the land-grant permanent fund should also be used to support this critical period of life, prenatal to 5?
Yeah, let's talk about that a little bit. How big of a question is this on the ballot for voters in New Mexico? Because voters are going to have a say in how this is all going to be funded, early childhood education and care. This is a big moment for folks in the industry. So could you share with the audience a little bit what's at stake here with this vote?
I think a lot is at stake on a couple levels. One, we know that more funding is needed to fully fund the prenatal to 5 system in our state. We know from the research that by fully funding high quality prenatal to 5, the returns to our state will come in so many different ways. So on that, we know that the Land Grant Permanent Fund was meant to care for and educate the people of New Mexico. We know that education begins prenatally, that it begins at birth. So I think both for the literal financial support for the department to realize its vision and its mission that the legislature and the governor want. We need these resources. And then just practically, I mean, this is the land grant for the people of New Mexico. We have families who are struggling every day to get the care they need, to get their children the programs and services they want and they need and deserve. And so that's why the land grant is an important resource and an important source of funding for early childhood education and care.
Now, when it comes to early childhood education, there's been a lot of reporting in New Mexico in the past that New Mexico wasn't on the same page with the federal government when it comes to some of these facilities. How do you think New Mexico is doing right now, and how do you see your role making an impact in improving communication between the federal government and New Mexico to ensure they are on the same page when it comes to early childhood education and care?
Right now, we're pretty aligned. We're very aligned with the administration in Washington in terms of what is important, in terms of continuity of care for children, high quality facilities, the ability of families to have a choice in where they. So I'm not sure. I'm not.
You can explain that a little bit more,
Okay.
like a choice in where they're going.
Exactly. So we talk about it as a mixed delivery system. So for pre-K, you might choose as a family that you have an infant and you have a 3-year-old. And so you want to go to a community-based program because you can drop both children off and you need full day, full year care. So we want to know that New Mexico pre-K can be offered there in a community-based child care program. But you might have a second grader and a 3 or 4-year-old, and what really would work for you is to be able to get your pre-K services at a school-based program. We met with Superintendent at Gadsden, which was great today to see their programs and see their summer jumpstart. Or you might feel more comfortable going to a family child care home. And so we want to make sure that New Mexico pre-K is offered in family child care, a community-based child care center, and our schools. So those are some ways that we talk about a mixed delivery system that values parent choice. So if we put all the programs in one type of setting, it might not work for all families. So that's where we're in alignment with this current administration in Washington and what we're doing here in New Mexico to build a strong early care and education system.
Here in Doña Ana County, there's a lot of excitement about the establishment of a mobile children's museum to travel throughout the county. You mentioned Gadsden, rural areas throughout the county, and here in Las Cruces as well, to get out to communities for educational opportunities at all various ages. What do we know what the research says that mobile museums like this can make a difference?
I don't have the direct research I can count, but I can tell you that is exactly the type of initiatives that we need to be supporting, because children need exposure to culture. They need exposure to ideas, and that is a brilliant idea, to take a museum on the road. I know we do that through the Department of Cultural Affairs. There are some other ways, but having a children's museum that's traveling into rural communities is so important. They're not going to have access to those types of opportunities. And those opportunities are, again, which create that strong early development.
Now, we just have a little over 3 minutes left with you, but I want to hear from you. What are some of the initiatives right now that your department is working on that you are really excited about and you think can make a difference?
Yeah. Well, I think the whole child care thing is very exciting. But as the governor tells me all the time, it's still not working for families, because sometimes a pre-K program is part day, they don't have before and after care, and they have to go somewhere else, but the parent's working. So what I'm excited about is really thinking with our local community partners. I'm excited that we have funded Engage as a local early childhood system building grant to say, what is it that the department can do so that you can better connect families in a seamless system of supports. I'm also very excited about our expansion of home visiting. We're continuing to expand that and reach more families in very rural parts of the state. And then, of course, just the most exciting part is putting it all together in a way that centers families in our policy making, in our budgeting, in our decision making.
Now with that, I mean, there also comes, I think, the need of transparency, which a lot of folks have raised concerns about. I've reported on education for nearly a decade here in New Mexico, and one of the things when I open up these reports that are made available to the public is, how do people who are not working in education education administration understand the data they're getting right now. So what are some things that your department is working on to ensure that you're transparent and also providing the data that our community needs to understand what our biggest challenges are when it comes to these issues with families and early childhood education?
It's such a great point. And actually talking to Lori last night with Engage, she showed me a great new dashboard that they have on the connection of community. So I think it's visualizing data in ways that is very plain language, that makes sense to families, to policymakers, to other educators. So I think our department has done a good job being very transparent with our decision making and with the things we're doing, but we could do better. So we want to make data, we want to democratize the data, put it in the hands of families, of child care providers, school districts, so that we can make better decisions and that we can transform and build the world-class prenatal to 5 system here in New Mexico.
Now, we just have under a minute left with you, but I'd like to hear from you a little bit about some accomplishments, because a lot of the issues that you're facing with, they're really generational problems that we have to address. And we may not know how successful they are until years down the road.
That's right.
But what are some things you could point to today that can say, this department is making a difference and here's why?
So one, I think, is that we have successfully continued to expand access and improve the quality of all of our programs. Remember, we were born in the pandemic, and it has not defined us, but everything day one, we continued. So we expanded that. The child care industry, what we have done for the child care industry alone is historic. And this expansion of child care, so I get calls every day from people all over the country wanting to know, how did we do it? And I'm going to tell you, this is going to be a game changer for New Mexico. The decision that our governor made to expand child care and to give access and no co-payments, this will be a game changer.
Okay, Secretary Groginsky, thank you so much for taking the time to talk with us.
Thank you.
And we want to thank you for joining us for another episode of Fronteras, A Changing America. I'm Anthony Maternal. We'll see you next time.